Hello, welcome to Caldwell County Today. I'm Paige Counts, Public Information Officer for Caldwell County. Joining me today is April Austin with the Caldwell Senior Center. Welcome, April.
Thanks for having me.
And we have great news.
We do. We have exciting news.
You're open.
We are officially open. We reopened March the 15th for use of our fitness rooms, computer labs, our billiards table, for people to come in for in-person Medicare counseling assistance, all of those things. And our classes are going to be starting back on April the 5th. It's going to look different, but they are coming back, and we're really excited because, it's been over a year. So we are really excited that we're able to kind of step into that and start reopening and offering some of those in-person groups again.
Now, what kind of guidelines do you have in place for being open?
So first of all, that's the number one thing is safety still. And I think everyone now is really aware of the safety precautions and the measures you need to take, even if you've been vaccinated in a public setting. So we have class size limits on all of our groups that are meeting. Everything is being coordinated where it can be socially distanced. The groups that can't easily be socially distanced are not going to be meeting quite yet. We're going to be postponing that for a little bit. But we have been able to work with just about all of our groups, except for our card playing groups, our bridge and euchre, to where we can do some things in person. So pretty much all the rest of our old groups that have met in classes are going to be coming back, plus some new classes that we haven't done before. So we have marked off our large room. We've got everything taped off and marked off to show where you can go it's a little different if you're in a class that moves around versus a class that's going to be set up at tables and chairs. So everything is marked, everything is set up. Masks are required. You have to wear masks even when you're exercising at this point. We have hand sanitizing stations and information for everyone, and we're screening everyone that comes in. So we've really taken a lot of steps to make sure everything's going to be done as safely as possible.
And we're going to start by talking about the moving around classes.
Yes. So we do have a little bit of a schedule change because our old classes exercise classes were on Mondays and Fridays at 8 o'clock in the morning, and we've moved everything to starting at 8:30 to give us time to make sure it's set up properly and sanitized and everything's ready to go. So we have our senior cardio and senior strength that are going to be coming back on Monday and Fridays. We have our balance builders. That's a new class. We actually have we're doing that virtually now, and we're going to be offering that one on Tuesday afternoons. Line dance is coming back. We are going to have a new class, a new Tai Chi class that's actually going to be offered in the evening. So that's something we're excited about. We're updating our hours, and we're actually going to start staying open late on Thursday afternoons, and we're going to offer a 5:30 Tai Chi class so that people who, one of the things, seniors over 60, a lot of times they're still working and they can't utilize our services. So they're going to be open, and we're going to offer that class in the evenings. And then, of course, we have yoga and our fitness room, and then our other groups are going to be coming back to kind of phased in, and we've made contact with the groups that were there and already established, and if new people want to come, we can get them information on the schedule changes and how to get signed up to come, because we are having people sign up to guarantee a spot. We'll let people show up, but if it's full and you didn't sign up, you're kind of the one that doesn't get to stay. So we're encouraging everybody to call us to sign up for everything, just to make sure we have enough space for people to come back.
But you're not doing away with the virtual world either.
We are not doing away with the virtual world. All of our exercise classes are going to work a little bit differently. So some of those classes are going to stay online only. Some of those classes are going to be kind of what we're calling a hybrid class, where it will be people in the center and on Zoom. And then there's some things we're going to keep doing that we were just doing for people who either aren't ready to come back yet, or aren't able to come back yet, or maybe even some people who weren't able to come prior to COVID because of transportation or illness, something like that. So we're still going to have our Friday morning Zoom chats. The topics vary every week. We are doing some telephone programs now, so we're going to talk some more specifically about those, but we've got some things that don't require you to have internet. That's one of the barriers to virtual programs, is people that don't have internet. We still put together puzzle packets and coloring packets every week and put new ones out. That's probably really been one of our most popular things we've done. We have a lot of people that come by and pick those up every week. So we're going to continue to do that. Maybe not forever, but at least for right now, those are going to be still happening. We are still going to keep doing our check-in calls. If there's people that are at home, they aren't, don't have a lot of people to talk to. Maybe their families work during the day and they're not able, and they'd like somebody just to call and check in. We'll do that. And then we're offering still our Zoom coaching. We have found sometimes people just are reluctant to use the virtual options because they don't know how. So we're doing some Zoom coaching, and we've done that online for months now. And we're actually now going to be able to offer that if someone wants to make an appointment. We can have somebody come into the center. They can bring their laptop or their iPad, and we will help them learn how to use Zoom if they want to be able to participate. Or we call it Zoom coaching because that's the one that most of our people are using and we use for our platforms. But we will also help if somebody wants to learn to use one of the other platforms as well.
So really it is about reaching people no matter where they're at.
Yes.
And speaking of that, this is probably one of my personal favorite things that you do, but your caregiver support group, and that's going to continue to be virtual.
It is for the time being. That's going to continue to meet virtually. So we meet on the first Wednesday of every month at 1 o'clock. Our next one is April the 7th, and then it'll be the first Wednesday in May, so we just keep going. And it's open for anyone who's a caregiver. They can attend. We can send anybody the link. They just need to call and let us know they'd like to have the link emailed to them, and we'll send them that to be able to get in. We are using Zoom for that platform. And what we typically do is offer a program in the beginning and it varies from month to month. In April, it's going to be about health and wellness, because one of the things we know is that caregivers do not take care of themselves. Mm-hmm. They are so busy taking care of their loved ones that they neglect their own health. So there's going to be some exercise information and some things you can do at home and do with your loved one. So, and those topics vary each month, but we are going to keep that online. And that one may stay online for a while because a lot of people who are caregivers are still not ready to come back out and face all the things that are going on. And we've been able to reach some people who wouldn't be able to come to an in-person support group anyway because they need to be home with their loved ones. So we will probably continue to offer that online for a while at least.
And another great program, and Lisa Cavanis from Hospice and I talked a little bit about this because April brings us National Healthcare Decision Day.
Yes.
You have an advanced care planning workshop.
We do. Hospice is one of our best partners. We have partnered with Hospice to do this workshop for many years now, and we did them in person, and as they were more than willing to continue doing them online. It's a little bit more involved to get everything done, but we're still making it work. And so on April the 8th at 1:30, we'll be having the session with Hospice. They'll review the healthcare power of attorney and the living will forms, and we will help you fill those out. And the only difference really now from what we did before is that we can't notarize them right that minute, but we will make appointments for you to come into the senior center, and we'll notarize those for you for free as well. So those documents are so important, and we can't stress enough, and I'm sure that they talked about it when they were here, but it's something you have to think about before you need it, because once you need those documents, it's too late. And I get a lot of calls from people who their family member or their loved one is in the hospital and not able to make decisions, and no one has a healthcare power of attorney, or they didn't have a living will. And so at that point, it's too late to do one. So it's something you really should think about ahead of time. And we're really grateful that we're able to continue offering these, even though we can't do them in person, and hope that we'll have some in-person options soon.
And you do those every month?
Every month on the second Thursday of every month. So, and it's the same date and time that it was in person. We kept everything as seamless as possible throughout this. So we still do them on the second Thursday at 1 o'clock, or 1:30, excuse me.
1:30, second Thursday. So if you can't make the April one, maybe
the May or June, yep, there'll be some more. Just call us and we can get you that information. And they're free. They're free programs. There's no fee for that. There's no fee for the notary. If they want to come and get them notarized at the senior center, we do that for free as well.
Now let's talk about something that I think is pretty fun, but you may have to explain it to folks how you're doing this exactly, because normally I think of bingo, I'm sitting in a big room with a whole bunch of people.
So now you're sitting in your living room in your recliner with your coffee and your bingo cards in front of you, and we're on the phone. So we have added a conference call line, and we've done this several times now, so we've got all the bugs worked out. It's a lot of fun. And we either mail you or you pick up your bingo cards, and we have a list so we know who has what cards and the numbers, and it's a little complicated on our end to keep up with it, but you get 2 cards. And you just find whatever you have laying around the house to cover your cards with, and we call the bingo numbers on the phone, and you win the prizes, and then you can either pick them up or we can send them to you. It's a lot of fun. It is a lot of fun. If you have a phone, you can do it. It's a local call, so people can just call in and play bingo with us. We've had a lot of laughs. We've had a lot of fun. We've got prizes still, so we have done this. This one will be our 3rd one. So if you are on our list, if you've played with us before, we'll call you to remind you. But if you haven't and you want to get signed up, we will get you your cards, get you signed up, and it's going to be April the 8th at 10 a.m.
So you can still play in your pajamas, really.
You can play in your pajamas. We can't see you.
So, you know.
The only pictures I get to post from phone bingo are of Ingrid calling bingo. So Ingrid's our bingo caller, so she gets on there and does that, and it's been a lot of fun. People have really enjoyed it, so we hope people would like to continue doing that. And it's something, again, that some of the people that are playing bingo are people who couldn't come to the senior center before, so we're able to still offer them services. Even though we're opening in person, yes, we'll probably have bingo in person again in the future, but for right now, we're still going to keep that going over the phone. And again, it's been a lot of fun, and we're doing some new things with our phone line.
Yes, you are. And speaking of new things with your phone line and reaching out to people who can't make it to the senior center, your phone chats have been a very great way of reaching out.
And the one that we're doing in April, we're doing one on April 22nd at 10. This is a little bit different than what we've done before. We've just been calling and checking in, and people call us and we chat with them. We're going to have a group chat. So you can call in. We will send you the number. You just let us know you want to be involved, and we will send you the number. And you call in at 10 o'clock on April the 22nd. And what we're going to do is we're going to have some topics, and they're topics that everyone can discuss. You don't need to have any special knowledge or any special skills. It's going to be it'll just for an example, and everyone's going to get a chance to go around and talk, but it'll be, what's your favorite color and why? What's your favorite flower? Share a story from your childhood we're going to have some different little topics to go around. This will develop into its own thing too, but we also have some things to kind of guide the conversation so people know where to get started. You are also free to call and listen. If you just want to listen in and you don't want to share with us, you don't have to. We're not going to pressure you to do anything. But we have had so much fun during the bingo just kind of talking with people that we thought we would give them the opportunity just to talk about some things. And we would throw some random questions out there. And, with us, you never know where it's going to go.
This is true.
You never know where it's going to go. So it'll be a lot of fun, just a chance for people to interact and talk and have a good time and laugh a little bit. We are big on laughter. We want everybody to have fun. It's not going to be anything serious. We're not going to get into any kind of, serious topics. We're just going to have a good time. And so anybody that's interested can call us, and we'll get them the information on how to call in.
Now for your more tech-savvy people, you still have a very active social media presence.
We do, and we're going to continue those. Travel Tuesday has been, we started Travel Tuesday last year on April the 7th because we were trying to think of things that we could do. What can we do? How do we get people, how do we connect with people, keep them interested? And we're like, we're going to go on a virtual field trip. And we did the first one, and people were like, oh, this is great. We love this. And every week, we still get feedback from people that they really, really love Travel Tuesday. We have gone to the space station. We have gone on an African safari. We have gone to Rome, Hawaii, the Great Barrier Reef. I can't even remember all the places that we've gone. We went to Memphis for Elvis Week. That's my favorite, so I can remember that one. But so we've been doing that, and people really enjoy it. So we're going to keep doing those. Our Wellness Wednesdays, we just share wellness tips. March was Nutrition Month, so we shared a lot of things about healthy eating and how to squeeze in those vegetables, how to hide those vegetables in some recipes if you don't really like them. Exercise videos, different wellness tips, and we're going to keep sharing those with people. And of course, our Facebook, we are working to build our Facebook following and offering some things on there. We've offered some live activities on Facebook, some videos that we post to Facebook. That's the place to go if you want to win prizes too, because we just randomly start putting things on our Facebook page and giving away prizes if people like or comment, or I think during the winter we did, post your favorite snow day activity and you got a chance to win a prize. So, and we have a lot of really good prizes. We have worked with some partners in the community and they've donated some prizes. So we have all kinds of prizes that we're giving away for things. So like us on Facebook and you might win some prizes.
And even if you are not a senior, like the Senior Center on Facebook.
Absolutely.
And share the information with your senior friends, because a lot of times conversations in my house start with, oh, did you see this on Facebook? And then we have a whole discussion about whatever the Senior Center's doing. So it is a really great way to connect.
And the other thing that we really want people to remember is our services aren't solely for seniors.
Right.
We are targeting caregivers. We're targeting people who know seniors, who connect with seniors. So you may find some things on there that you enjoy or you benefit from that you can share with others. And our educational programs are really a lot of times targeted toward anybody that might be interacting with people who are seniors or maybe have dementia or mental health. We really try to target people of all age groups. So like us on Facebook, you never know what you might find out.
Which leads us well to the next topic, which is how you can help.
Which is follow us on Facebook.
Right.
And we don't do all of the social media platforms at this point. We have tried to stick with the ones that the people that come to us interact with. So we do Facebook a lot. We do have a YouTube page, so you can go to YouTube, and we actually post some of our programs on YouTube. So if we have a speaker that you missed, a lot of times, with their permission, we will post those videos to Facebook and you can watch. If you missed our Advanced Directive live session, we actually have a recorded session that's on our YouTube channel, and so you can go and you can watch that and get the information that you may need. We've had some of our sessions that we've done with the library, with attorneys, different things, and those are on our YouTube page. So there's information that you can get there, and that's growing every day. We add new content to it pretty regularly, or trying to. Sometimes that's hard. I am the IT department. And YouTube has not been my friend. I have had to learn how to use YouTube, but we're getting there, and we're starting to get to where we can regularly get things posted on there. And some of us don't have that background, and we just had to jump in and figure it out. So.
Exactly. Some of us are a little older, and we weren't born with a phone in our hand, so we struggle a little bit sometimes.
But we are definitely working to get that information out there, and that's something we had talked about long before COVID was, how do we get the information to people who can't come to us? And YouTube was something we discussed then, and it just sort of so happened that we were almost, I don't want to say forced into it, but it really gave us the incentive to look at how to do that and how to make that work. So we're working on that every day.
Well, as we talked through some of these things, I was thinking a year ago we were sitting here, and a lot of it was, we don't know how we're going to do this, but we're going to find a way. We're going to find programs.
Yes.
And you've done an amazing job finding programs and finding the things that work.
That's really been, we just we've tried a lot of things. Some of those things got thrown out the window because they didn't work, and some of the things did, and we are still developing those programs, and we want to hear from people. If you like something we've done, if you would like to see us try something, let us know. If you have an idea for a program, we're currently reinventing ourselves by the minute. So anytime somebody has a suggestion, we want to hear that.
But there are other ways
yes.
that people can help.
Puzzles. We always need puzzle donations. We have given away thousands of puzzles in the last year. And we have people come every day for puzzles, and that is something people can do at home. And we still have them where they can pick them up without contact. They don't have to come into the center. They don't have to interact with anyone if they don't want to. They're outside, and they can just go in, pick up the puzzles, and take those home. So we always need those. If you have puzzles that you would like to donate, they don't have to be new puzzles. We will sanitize the boxes and put them on a shelf for a period of time, and then we'll bring them out and kind of rotate those through. But we greatly appreciate anyone who would like to donate those.
So really, puzzles of any size, any design?
Size. Yes. We have people who do them all. From 100 pieces to, I think the biggest one we've had is 2,000 pieces. I can't imagine doing a 2,000 piece puzzle, but some people really like those. So all designs, all shapes, sizes, we have people that like all of them. So
just puzzles.
Yes, absolutely.
And you also talk about attending your programs, which we've talked a lot about.
We have.
But people can always donate.
Yes. We are always in need of donations that go to support the services that we do. We always, if you are able to donate to the Senior Center, we greatly appreciate that. And that can be financial donations. That can be puzzle donations. That can also be donations of medical equipment, or we have people a lot of times who are in need of wheelchairs, walkers, incontinence supplies, things like that. We can't take any kind of equipment that's motorized. We can't use any kind of equipment that's motorized. And we can't take any kind of medical supplies that have to have a doctor's order. So we can't take oxygen equipment or diabetic supplies. But we have a lot of people who their insurance maybe will pay for a walker, but it won't pay for one every 5 years, and there's something wrong with the one they have. And so we try to kind of keep those things. And if you have those, we need those donations, and we really can use those to support the community. So if you can donate to us, that would be wonderful.
But there's another way people can help, and this is more giving of themselves.
Yes. And this is probably the most important. We haven't talked about this in a while because we have not been able to utilize our volunteers in a way that we could do it safely, but for a few things. So volunteers were a huge piece of our senior center pre-COVID. We can't survive without our volunteers. They mean the world to us. They are what keeps us going. And a lot of our volunteers, we've had some of our regular volunteers who have moved, some who have moved on to other opportunities. They're doing some different things. And so we did want to put out there that we are looking for volunteers. And we have some new things that we are looking for volunteers for. So we always use volunteers as our receptionist. So if people would like to work, and we are so flexible, we can work with anyone's schedule. You can work every day, you can work a day a month, you can work half a day a month, you can, work every third Friday. We can really work with your schedule. But we need people that can help answer the phones and check people in when they come in, make sure they sign in, direct people if they need to pick something up or that sort of thing. We need people that want to lead programs, and those can be anything. We have different groups. If you have a special skill that you would like to do, you never know when a group might want to get together. And we're always looking for new groups. So if people have an interest that you would like to meet with a group, we're interested in talking to you about it because it might be something that we can set up. In the past, we've had book clubs and basket weaving and things like that we don't have someone to coordinate. So if people are interested, we would love to have you. If you have an exercise skill and would like to teach a class, if you have a special hobby, or if you would just like to lead a session that's a social type activity, we would like for you to get in touch with us so we can see about setting some things up. We're always looking for SHIP counselors, and for those of you who don't know, that's the Senior Health Insurance Information Program. It's one of our largest programs, and we were able to continue through the last year doing all of that by phone or virtually, but we typically do meet in person. But people who can help counsel seniors on their insurance decisions and their Medicare decisions with their drug plans and Advantage plans. We do all the training. We give you plenty of training, and we are always looking for people who would like to help with that. Again, it's flexible. We can work with your schedule. And our newest thing that we're doing is we are trying to build a senior center advisory committee. So people who are interested in meeting and talking about services that the senior center provides to the community, how we can do better outreach to the community, things that we can do. We're looking for people who would like to serve on that advisory board. So any of those things we can talk to you about, give you more information if you're interested in volunteering. But we are trying to rebuild our volunteer base and get some new volunteers and get our old volunteers back and started. We're starting in April. Some of our old volunteers are coming back, so we're excited to be able to see them again. So we have people, we're going to start bringing people back in. Again, everything's going to be done in a safe manner. Some of these things will still be done. You know, you can teach your classes virtually if you don't want to come in person. We're always up for different things. And maybe you just want to teach a class one time. That's a great opportunity for our Friday Zoom chats. If you have something you'd just like to share with people one time, if you have a special interest or a special hobby you'd like to share, we can set that up as a one-time event as well.
So really, endless opportunities.
Endless opportunities for
Endless
volunteers.
opportunities to volunteer. So if you've been thinking while we're stuck at home during COVID, I want a new way to get out, I want to connect with people, this really could be your way to do that.
And April is National Volunteer Appreciation, so we're going to be celebrating our volunteers during the month of April. We have some special things, and those that have volunteered with us in the past will hear some more about that. But we figure out it's a good time to let people know. The other thing that we do is maybe the senior center is not a fit for you, but you still want to volunteer. We keep a database of resources for volunteer opportunities in the community, and we can also help link you up with the other organizations who need volunteers, because we realize our setup is not necessarily a fit for everybody, but we do still, community involvement is so important, and seniors are the backbones of volunteers. We all know that. Senior citizens are the bread and butter for our volunteer world. We all need them, and we keep a resource list of other opportunities. So if you are interested and maybe the senior center is not your fit, still call us and we can link you up with the organizations that you might be interested in.
And when you say you keep a database of resources, again, my line to someone who is looking for help for senior adults is call the senior center. I actually told a group the other day, I'm like, if you're working with senior adults, you need to call April, set up an appointment with her, and just go talk to her and pick her brain. Just because they have that many resources and know the connections.
We do try to keep that. That's one of the primary functions. We try to keep our resource list up to date and current, and we were actually working on that today because it's been a year and things have gotten kind of piled up and jumbled, and we're trying to reorganize things and make sure that we have easy access to that information, and we have some actual new layouts of how we're finding, organizing our information, because used to we just had this information resource center in the hallway and there was tons of information. So we're actually categorizing it and putting it into a catalog type format where people will be able to just look for the type of information, and all of our receptionists and all of our staff are going to have a copy too, so we can help direct you to the right information, and we will definitely do that.
And more new things, and you mentioned this earlier, but you have new hours, and when I glanced through this earlier, I was like, wow, that's quite a change for you.
It's a big change for us. We were always open 9 to 5 before, and throughout this and throughout we had some 8 o'clock exercise classes before anything else was open, and we actually planned this before March of 2020. We didn't get there because everything just sort of kind of upended, but we really did want to target the opportunity for people who could not use the center from 9 to 5 to be able to come in and use the center at least part of the time. And if anyone has ever been there, Friday afternoons at the senior center are really, everybody has other things to do. So we looked at the times that people wanted to come. We did some surveys. We talked to a lot of people. Exercise classes, most people really wanted early in the morning. There's a few that want afternoons and evenings, so we're trying to accommodate everybody. So we are going to be open Monday through Wednesday from 8 to 4, Thursday from 8 to 7, and then Friday we'll be open from 8 to 1. And so it's a change. It's going to be different. It's going to look different for people. But that leaves the Thursday evenings for people to come in and utilize the fitness room, the billiards table, the computer lab. There will be some special programming going on that comes and goes, different things, opportunities. And then we will be doing a 5:30 Tai Chi class that is going to be taught by Ellen Kreider, who's our yoga instructor. She's going to do an evening Tai Chi class. So that will give an opportunity for some different people to see what we have and what we offer. And I think it will be, I think people will really enjoy that once we get everything up and going.
I think they will.
And I know they want it to be open at 8 o'clock because they're usually lined up at the door.
Fair enough. So, as my parents keep telling me, retired people don't get up early. That's not true. Some do.
Some do.
Some do, and some like the early morning hours. So.
And we want to accommodate all of them. So that's what we were trying to do, is work out a solution that meets the needs of the most people we can meet.
And it sounds like you're doing that. You really have everything covered, it sounds like.
We hope so. But again, we're always looking for feedback. So if somebody has a suggestion or a thought or comment, we want to hear that. And you can call us, you can email us, you can stop by and let us know. You can come in now. The door is open.
The door, that's so exciting to hear.
That actually is really exciting to hear, because our door has been locked for so long. Everyone knows that COVID really impacted the senior population, and to get to a point where we think we can start to safely reopen again, not without precautions and not without safety measures, but that we can let people come in and participate in our activities, is really exciting.
April, what's the phone number to call for registration, to resources and assistance?
They can call. Our number is 828-758-2883, and they will be directed to the correct person for whatever service they're in need of.
And your Facebook?
Is, now you have to be really careful with Facebook.
Yes.
And if you search for @Caldwell Senior Center NC, you will get us, because there are Caldwell Senior Centers in Texas and Idaho, and I believe Kentucky is the other one. So, and we get calls regularly. Mm-hmm. Actually, I got an email from somebody in Texas today. So we get calls regularly. So make sure you have found the right senior center, but it is Caldwell Senior Center NC.
And I believe you have the full name of the senior center
is on the Facebook page. Yep.
In parentheses.
Yes.
So that's a good clue.
It is a clue. So we have the full name up there, but the way to search for it is using the @Caldwell Senior Center NC, and that'll bring you right to it. But if you put in Caldwell Senior Center, just make sure you look for the one that says the Sadie and J.E. Broyhill Caldwell Senior Center. And
your website?
It is www.caldwellseniorcenter.org. And we have a lot of information. That webpage actually will also be updated starting in April. We'll have some updates to the website to reflect the changes, the programs, the schedules. We also have our newsletter available for people to be able to pick up outside if they want to just come by and pick one up. It's also online as well.
Lots of information. Lots of new programs.
Yes.
I'm so excited that you're open, and I can't wait to go over and film a show with your seniors there and all the excitement going on.
It's really exciting. We're very happy that we're able to do this, and we hope things continue in this positive trend. Of course, we will react appropriately depending on what, but we've updated our computer system, so we do have the COVID screening when people sign in. This on the computer system, so we do have the contact tracing available should that ever become a need. We have the ability to do that, so we have a lot of resources that we put into making sure that it's safe, and if something were to happen, that we can immediately contact people that we need to reach. And
And hopefully that's not going to happen and you're not going to need that. That's what we're going to hope.
Absolutely. And we also, as a side note, if anyone has not been able to get scheduled for their vaccine, we can help get people directed to the most appropriate place to get the vaccine and get those appointments set up.
So, April, thank you for being here. And again, I'm really excited that you're opening back up and that you're going to be serving even more seniors.
Absolutely. We can't wait.
Thank you. And thank you for watching Caldwell County Today.